Government says the NHI will be implemented in a phased approach in an already overwhelmed health system with many challenges. Systemic governance challenges continue to have a debilitating impact on the health system. But to discuss that, I am now joined by Sonwabo Lindani, who is the acting chief director of the Sedibeng Health District, which is comprised of 3 hospitals and 38 clinics. Sonwabo, a good morning, or rather afternoon now, to you, and thank you so much for joining us. I think let's start here. Your initial thoughts on hearing at the beginning of the week that, right, on Wednesday, the president will be signing the NHI bill into law.
Good afternoon, Naledi, and thank you for the opportunity to have a say on NHI. It has been indeed a very big achievement, a milestone for the country to be able to sign this bill into an act, which is a symbolic gesture that has been shown, I think, live in all TV stations in the country, when our president was signing this bill into an act. Naledi, I think it has been a matter of time before we reach this stage.
Yeah.
NHI is not a drive only for our country. I think different countries, they call it different things. But the main goal here, it comes from the World Health Organization, which advocates for all the countries globally to roll out health system in what is called universal health care. Universal health care, it means everybody must have access to the services regardless of their financial status. So that's what the World Health Organization is advocating for. Our country is using a vehicle called NHI. NHI is not a health system. It is a funding model that will actually lead this country eventually to what is called universal health coverage. It is indeed a very big occasion for the country, but indeed this will happen incrementally and over time. As the minister has stated.
Well, the minister has said 4 years. Experts and pundits are saying no. We're looking at another 30 years before we see the implementation of universal health. What's plausible and feasible? Okay.
Indeed, I think the minister is quite correct. This will happen over time. In fact, I'm currently a student doing my study of my PhD with basis on NHI. So I've been reading a lot of papers, I think, globally on how the other countries have phased in their forms of NHIs. But the bigger goal, as I stated earlier, it is universal healthcare coverage. NHI is promoting wellness of our people, and it says our people must get services closer to where they live. So one of the things that are kind of going to be focusing on under the universal healthcare coverage is to ensure that people they engage in these wellness activities and they are able to get services at a primary healthcare level. And I know that there's been a lot of questions regardless. I think the main thing here is about Section 33 of the bill, which talks about who can provide the services in the country when this act is fully functional. So globally, Naledi, what I can state to you, based on the research that I've been going through, there is no country that is providing universal health coverage only by government, excluding the private sector. So the main thing here is that everybody will need to be contracted to NHI to be able to provide services. So that is the main thing. And the funds will be regulated. So there is no way that private sector will be abolished, but the main service provider, for you to be able to provide these services, you must be enrolled and accredited through NHI body. So anybody can go and be contracted. It can be a GP, it can be a practice, it can all the government facilities. You won't just provide the services. You must meet certain standards. We're currently engaged on assessment led by the Office of Health Standard Compliance. All the facilities, they need to be accredited so that they are eligible to be enrolled to NHI. But that will happen over time because we still have to appoint the board, we still have to appoint the CEO, all those things, the fund, it has to be established, who's going to manage and administer this fund. So those things will take time and for them to be in place before we can see changes.
Yeah.
We've been seeing the jokes, people rocking up in private. It can't happen in that manner.
Yeah, I mean, that's obviously that's social media memeing, but we need to have a really serious discussion about, what really is a basic human right? Access to health is incredibly important. And part of the challenges of what NHI really wants to address is allow for better access of this all-important basic human right. But if we're going to see NHI rolled out only in a few years, then obviously we need to be finding ways to improve public health as it stands at the moment. Now, your own region, Sedibeng, has had multiple challenges where where health is concerned. I mean, you oversee 3 hospitals and 38 clinics. You've had HEITU, so that's the Health and Allied Workers Indaba Trade Union, coming out in full rage, really, over the state of healthcare facilities in your region, Sonwabo. I mean, HEITU spokesperson Lerato Mthunzi talking about temporary clinics that are unsafe for health workers to work in, feeling that those very structures are collapsing. And the reason why these temporary structures are in place in the first place is because the infrastructure of the clinics and hospitals that is there is not being maintained, is not being improved upon. So, I mean, where are we in dealing with those challenges in your region?
Thank you so much, Naledi. I think we have engaged in a lot of pragmatic steps to ensure that all those infrastructure issues are sorted. We have plans that we have done through the infrastructure department. Within this financial year, we'll be able to revive a lot of those. And I think a lot of these, they were kind of working like something when they were designed, something like your CCMGD model, which was an outcome of a pilot of NHI. So some of those health posts, they are kind of used now as clinics, of which they are not designed to be clinics. I think, Naledi, you are mentioning one important element here, which comes up clearly in my data when I'm reading much more on the universal health coverage as well as NHI. Currently, 80% of the population of the country access health services in the public service. And currently, only less than 15% of the population are covered with medical aids. So a lot of resources, they are kind of in private sector where there is fewer of the population. So the resource limitation, it has everything to do with the budget distribution, which is going to be kind of managed and sorted through the NHI. And Naledi, we need to start somewhere. We can't wait for a perfect situation for us to start. We need to know that we're going to move and incrementally improve the health system over time. It can't be an overnight thing where we are kind of opening and switching off a TV. So it won't work like that, but incrementally, definitely we'll end up phasing in the universal health coverage over time with the resources being pulled together to actually serve all our people regardless of their financial status.
Yeah, but you see, I'm going to stay with this issue though, because it certainly is one thing to look forward to NHI and money and resources that come in to improve just the capacity challenges that you're dealing with, where you say, well, 80% of the South African population uses public healthcare facilities, and that is a strain on those facilities. But surely some things just need to work. I mean, in Sedibeng, again, your region, it's understood that in March this year, there were reports of a lack of working landline phones at all healthcare facilities in your region. I mean, surely a landline that works is important and does not need to wait for universal healthcare.
No, I think that is proper, and I think it's a fair one. That issue has been advocated for and talked through our official communication as a department. I think we had some issues with telecom, I think provincial, not one district. So all that is history now, it has been sorted. So there were billing issues that had to be sorted. It was not a financial issue. So all those, when they were addressed and then the payments were done, there is no health facility that doesn't have working and functional landlines. Everything boils down, Naledi, to planning. Everything boils down to a proper vision of what we want to achieve and how long we want to take to get there. For us to be able to deal and manage the debilitated infrastructure that is quite old, that needs a lot of resources. As you all know, Naledi, is that, I mean, our country is not in a very good financial position. We're trying our best, I think, in terms of creating employment so that we increase your tax revenue. Then if that happens, then all the other areas that government is supposed to supply and provide for in terms of the budget, they'll be covered. But incrementally, we have everything in place. We have plans in place to ensure that all the infrastructure issues are sorted. The tools of trade, they're in place for the workers to work. We are currently pushing for what is called I Serve with a Smile as the health sector, particularly in Gauteng. You can't serve with a smile, definitely, if you are working in an environment that is not conducive for you to do that. We're very deliberate and pragmatic in ensuring that the services are provided in a timely manner, in a quality manner, and we make our people to feel dignified when we render these services in our public sector.
Yeah, obviously we need speedy responses where challenges like that do occur. Well, I think just to wrap things up, Sonwabo, and final thoughts really on as we await universal healthcare to become a reality beyond just the signing of the bill into law. You know, who we hold accountable when we do see infrastructure backlogs of the maintenance of our health infrastructure, certainly staff shortages and all of those. Who should we be pointing the finger at when we say, let's improve the healthcare system in the meantime?
As leaders, Naledi, one of the important elements in leadership is accountability. One of the important elements is to actually be very open and transparent, not be defensive at any situation. If there are problems, in fact, I normally say there are 4 roles of a leader. One is to prevent, and the other, when problems have happened, you manage them as a leader. So we're at the level where we are managing the challenges that we're facing. We're facing the huge burdens of people that are coming to the public sector, which is why it is fundamentally important that we move and charter our country towards this universal health coverage, which will ensure that there are plenty of resources in place for us to be able to manage these infrastructure backlogs. We ensure that the tools of trade, they are in place. All facilities are in a good position to provide these quality services. So indeed, we have plans that are set in place to actually manage these projects that will lead to infrastructure that is of quality, so that when our people are arriving in these places for a care, you actually get, I was managing Fireland Hospital at some point. So you can go there, when you come by the gate, you want you to be healed when coming by the gate. So you must come to this therapeutic environment, toilets that are working. You are able to get your file very fast. We've enrolled the one patient, one file system in the province. So all those mechanisms are put in place to ensure that our patient experience when they visit our facilities, it is indeed improved.
All right, we're going to leave it there. Thank you so much for speaking to us. We do appreciate your time. Sonwabo Lindani, Acting Chief Director for Sedibeng Health District. Of course, he oversees 3 hospitals and 38 clinics. So speaking to us about really the expectation that has been created with that NHI bill being passed and the work that needs to be done in the years to come before NHI starts to become, I suppose, a reality that is manifested. All right.